Well, it's a great pleasure to be here and to talk to you about some of the infrastructure needs prior to considering the use of vaccination for highly pathogenic avian influenza. First, I want to mention the most significant, larger elements of infrastructure as we see them. One being what we call the professional aspects, meaning the veterinary services and all what goes with the veterinary services. Then the legal aspects, including legislation, the political will, regulatory aspects necessary for the enforcement of a vaccination campaign. Other elements of importance are the collaboration between the various sectors, veterinary services with ministries of public health in other important sectors of government, as well as with international organizations and the private sector. The internal communications and external communications are also vital to be able to have the public and the affected industry understand the campaign prior to its initiation. Now, talking about the veterinary services and what are the fundamental components for veterinary services, I see a vaccination, avian influenza vaccination, as one of the many tools necessary for dealing with the control and eradication of avian influenza. And I see the infrastructure of the veterinary services almost as a box containing these various tools, one of them being vaccination. So within the components of the veterinary services, first we have the human and financial resources. Then the technical authority and the capability to enforce some of these. The interaction with stakeholders, and also some key elements dealing with access to market. And I will explain these components more in detail. For us to understand that using the language currently in the international code of the OIE is we recognize veterinary service as a very large structure. The veterinary administration meaning the government component of such service. The veterinary authority, the one that has the legal authority to do certification, to enforce regulations and others. But the private sector, the private veterinarians are also considered elements of the national veterinary services, and so are paraprofessionals. In some countries, quite often paraprofessionals will outnumber the professionals, particularly in developing countries where we see a rather small or weak veterinary infrastructure. Now, within the human and financial resources that are of importance as we see in a situation like a vaccination campaign, is the professional and technical competencies of the veterinary services and the systems in place for an on-the-job training and updating of the skills of these professionals. The ability for veterinary services to operate independently, to make decisions independently from political and other pressures. The stability of the policies and their programs, the regulations to be stable and not to be constantly changing according to needs and pressures. The coordination capacity of the veterinary services, as I said earlier, to be able to work with other sectors of government, other institutions, and the private sector, the industry. And obviously, a very essential component is the funding, including the availability of contingency funding for situations such as an emergency where we're going to be considering the vaccination. Another interesting group of factors is those technical authorities and capabilities. The ability of the veterinary services to have the diagnostic capability to collect and examine these samples, to have access to reference laboratories, to have the ability to do risk analysis, to be able to establish and enforce quarantines, to do the epidemiological surveillance necessary for prior, during, and after a campaign, and to have the tools and the system in place for an emergency response, to be able to rapidly shift and respond to emergencies. It is also very important, quite often underestimated, the importance of the interaction with stakeholders. By this I mean the consultation, the dialogue, not only the providing information to the public and the industry, but to dialogue, to communicate, to consider them officially in decision-making groups, task forces, and others, to include them in providing authorization, accredit them, delegate some of the functions, as I will talk in a few minutes, but without forgetting that the ultimate certification authority will continue to be the veterinary services, while the job will be done in partnership with the private sector. So it's important that these programs be implemented jointly, particularly when I refer to one in particular as I'm thinking about of compartmentalization. It is also important to consider trade-relevant activities, particularly in countries where the international trade in poultry and poultry products is very important. So it's essential that the trading partners recognize the credibility of the official sanitary certification coming from veterinary services. It's very important to have a very clear understanding of the responsibilities and the accountability of each of the players, both in the public and the private sector. Establish equivalency agreements, and I will use compartmentalization as an example, where already there is an agreement and an understanding of the credibility of this infrastructure, both private and public, prior to initiation of the trade, and even more importantly, prior to a crisis such as an avian influenza outbreak. Important to have the ability to trace back, to be able to go back to the origin of the source in case of a problem. And to have the ability not only to consider and establish zoning and compartmentalization, but to be able to discuss that with trading partners. So a few words about zoning and compartmentalization. And I think the latter particularly is of great importance as a tool in managing a control and eradication campaign, whether it be with or without vaccination. Zoning is a concept quite well known, particularly in diseases such as foot-and-mouth disease, where subpopulations within a country are separated primarily on the basis of geography. We divide them using political borders or geographical borders. We have a state or a province that may be free of the disease, while another one may have another sanitary status. Whereas compartmentalization is primarily the separation of subpopulations on the basis of biosecurity measures. Of course, geography plays a factor, and biosecurity plays an important role in zoning as well. But the importance in compartmentalization is that it's primarily on the basis of biosecurity. And here, when formulating and establishing how one will establish these compartments, it's essential to know the role of wildlife, the epidemiology, the important role of wildlife that may or may not play, and we know in the case of avian influenza, is extremely important. And also it's important to establish clearly the role of the private and the public sector in the establishment and the management, the enforcement of the different elements of compartmentalization. So just graphically, I wanted to show very simple the examples, one of zones. As you can see, we have in the center an infected zone which separate from the free zone by a surveillance zone. And I have used symbolically here a main road, a railroad, and a river as the borders to this zone. Whereas when we look at the very simple schematic of a compartment, the compartment is which incorporates the different elements of a poultry production, incorporating the feed supply, the breeding stock, the growing flock, the slaughterhouse, and all of the elements necessary to move these animals from one place to the other. In other words, through biosecurity, contain all of these elements into one and be able to demonstrate that through biosecurity we separate these from the other subpopulations that may be infected or at least of an unknown status. Now, why is compartmentalization so important? One is that it will allow for trade to continue even if the country is not free of avian influenza. It can have compartments that are free and maintained free thanks to biosecurity without vaccination, while vaccination may be applied in other subpopulations of higher risk. It guarantees the status of a compartment even if the risk is coming from wildlife. The other interesting concept compared to some of the more traditional programs is that the resources required come from various sectors and quite often come from the benefited. In other words, quite a lot of the resources required for implementing compartmentalization are volunteered by the industry, which is the most seriously affected, and quite often in countries where the governments don't have the resources, the industry is quite willing to come up or to share the cost of establishing such a compartment. The benefit, the industry is quite often responsible for conducting and enforcing the biosecurity, but we shall never forget that the audits and the official certification is always in the hands of the veterinary authority. And this is very important in the case of international trade, because it's a veterinary authority of that country, the one that has to be credible and that will be certifying and guaranteeing the safety of those products that are going to be traded. Now, for compartmentalization to be successful, there has to be a credible veterinary services, in that it has to have a good track history. It has to be good at notifying and transparent in notifying the presence of disease. The compartments have to be based on known epidemiology. We have to be able to demonstrate that with the biosecurity measures in place, one is able to separate these populations of unknown status from the one that we want to maintain free. There's a very clear and important role of the private and the public sector. This is not a program that can be managed strictly by the public sector. And what is very important is that these conditions should be negotiated with the trading partners, what I call during peacetime. In other words, once the dialogue has been established between private and public, and once one agrees as to what compartment makes sense to maintain free, justifies the resources required, then one should go to the trading partners, show this plan, and allow for a dialogue, and even to meet some additional requirements that the importing country may want to have during peacetime, so that when the infection, or should an infection come into the country, the trade flow will continue uninterrupted, because there's already a pre-agreed commitment that if these measures are put in place, the compartment will continue to be considered free for the purpose of trade. Talking about some other factors of importance. One, the factors that are important in the case of a vaccination campaign are the cost of the vaccine and the cost of the delivery of the vaccine. Even more importantly, the availability of the vaccine. Quite often when massive campaigns have to be initiated rapidly, the resources, the funds may be there, but the vaccine may not be available. Another essential component is to have the resources for producer compensation. The rapidity of notification, the transparency of notification, and the ability to mobilize resources rapidly where they are needed depends to a great extent in the willingness of the villager or the farmer to report the cases. And they are closely related to the ability to compensate the willingness of these producers to provide the information rapidly. It is also necessary to have an education and awareness campaign. Not only the producers, but the private sector, the consumers, and others need to be kept informed and explain where the risks really are, and the necessary resources for additional epidemic surveillance during the crisis and after the crisis. For a vaccine, I repeat again the importance of the credibility and the competency of the veterinary services, but also the political will and the government support. In order to establish these, not only does the veterinary infrastructure need to play a role, but at times the veterinary authorities alone are not capable of influencing the political powers of the government as to the need and the importance in how to conduct a control program, how and why to incorporate vaccination. Quite often the issue is not a technical one, but a very serious political one, where other forces are competing with the veterinary authorities in trying to convince the government that it is appropriate to apply vaccination. Therefore, it's very important that the stakeholders and the public understand and buy in, see the benefit both to public health and animal health to applying vaccination. As I mentioned earlier, the necessary, the adequate funding for these different elements. And it's also important for the government, the political side of the government, as well as for the veterinary services and the industry, to discuss and analyze the trade consequences. And by that I mean, if vaccination is going to be used, what subpopulation should be used? Is there a benefit in not vaccinating the biocontained industrial part of poultry, but to vaccinate those subpopulations more at risk? it is very important, based on history we have seen, to consider and weigh in, although internationally and based on international standards, trade flow should continue and not always occurs that way. So it is important to have these analyses as to what population to vaccinate or not prior to the initiation of a campaign. And also to conduct the preventive negotiations. What I mean by that is that prior to initiating, discuss this with your trading partners and make sure that they're in agreement as to why and which population will be vaccinated. Complementary to vaccination, the other pieces that we find in this toolbox are the traditional ones, such as culling. We need to review and make sure that we have the adequate methods and the capacity to depopulate, the capacity to transport these products if they need to be moved out of the affected farm, the ability to destruct and disinfect, the enforceability of movement restrictions. Quite often other sectors, such as law enforcement, need to be brought in to make sure that one can guarantee that these quarantine measures are applied. And also to consider alternative slaughter and marketing procedures. Some of these birds don't need to be destroyed, particularly in cases where one is dealing with low pathogenic avian influenza. Alternative mechanisms for marketing, even for cooking, that would lessen the impact on exports. And prior to establishing a vaccination campaign, one should examine and make sure that the resources are there for vaccination, for the necessary compensation, the application of these various measures, the knowledge and ability to be sure that one can access these various subpopulations. Probably in a country, it may be very easy to access with the private sector knowledge the industrial part of poultry, but quite often the backyard in the more rural areas are not that easy to access, and one needs to make sure that this can be done and can be done rapidly enough. The adequacy as to whether we can apply the biosecurity measures. What is the density of the industry in affected areas? Are they too dense where additional measures need to be considered, etc.? The technical preparedness and the training of the personnel. Do we have sufficient people properly trained to conduct the vaccination and the additional epidemiological investigations? And very, very important is to have an exit strategy prior to initiating vaccination, to know exactly when and under what conditions vaccination will be ceased. It's also essential to have a clear understanding of the structure of the poultry sector in the country. I have just simplified by identifying 4 different groups. One that I would call the highly industrialized, which is one very integrated, very densely populated, for commercial purposes, usually dealing with a single breed, and devoted primarily for international trade. In a subpopulation like this, the veterinary care is usually very good and in-house. The next one, with slightly less biocontainment guarantees, also is a densely populated and commercial one, usually dealing with just one breed, but catering more to national markets with a slightly weaker biosecurity and usually with good veterinary care. The next one would be one more traditional one where there's minimum biosecurity, catering primarily to the local markets. They usually have more than one breed or species even, and there's rather spotty and irregular veterinary care. And finally, the backyard, which is free range without any biosecurity, low numbers per owner, mix of different breeds, operated on rooftops, fighting cocks and others. And in these ones, quite rarely, we do see the presence of veterinary care. And it's very important to know where these various systems are operating, because they have to be managed very differently in case of vaccination. Not to forget the need to train or to review, make sure that the personnel does have the necessary training for the administration of vaccines, for storage and the management of the records. Other group for the enforcement of movement control, the culling, the stamping out, disinfection and disposal, have the proper equipment for that. Managing the compensation scheme, that has to be properly managed. Farmers have to be paid quickly in the right amount. One cannot pay too much or too little, or the compensation becomes a problem rather than contributing to the solution. One has not to forget the importance of having communication specialists that can continue to keep stakeholders and public informed as to what we are doing it, why, and that there is no risk. And the trainers to train the people above mentioned. At the OIE was also mentioned the importance of working with vaccine banks. And in the case of avian influenza, one will consider a possibility where through tenders there is the establishment of a vaccine bank, possibly at a regional level. But for this, there has to be a very close collaboration between the manufacturers and the international organizations that would be managing this bank. And there has to be a pre-planning on the needs for emergency vaccination and very clear terms of reference for how and when and who and how it's going to be done for the withdrawal of the vaccines and the forms of payment. Just quickly in summary, in no particular order, a quick checklist of things to be considered prior to vaccination. I repeat the importance of the competency of veterinary services, to have a clear understanding of the epidemiological situation in the country and the various regions in the country, to understand and know the structure of the poultry industry and the systems they use, the levels of consumer and farmer awareness, and to coordinate the message with other necessary sectors, to have the diagnostic capability and the ability to enforce quarantines, to have a well-established and well-funded compensation mechanism, to have a clear objective as to of this campaign, whether it is an emergency, whether it is a preventive, to have good information on the epidemiological situation before, during, and after the campaign, have the financial resources and the vaccines available, and the human resources properly trained. And finally, why vaccination? Well, obviously, it's a very effective complementary tool when used properly. But it must be used. It's not an alternative. It must be used in conjunction with several others. It definitely will reduce the necessity to having to do massive cullings. It will reduce the viral load and therefore reduce the risk to humans and reduce the spread of the virus. So in conclusion, I want to just show us a few slides on how we propose and how we manage the evaluation of veterinary services, whether it is prior to a crisis like highly pathogenic avian influenza, or just to have an understanding as to how well the veterinary services is working in relation to the international standards of the quality of veterinary services. So the tool is established on the basis of the articles of evaluation and quality of veterinary services in the International Terrestrial Animal Health Code, or the OIE. And then the tool itself was initially developed in partnership between the OIE and the Inter-American Institute of Agricultural Collaboration, IICA, which is a tool so-called the PVS, or Performance, Vision, and Strategy, that through a series of questions analyzes the status and where the gaps are between the performance of a veterinary service and the international standard. And there's an agreement currently with the World Bank where they will be using this tool prior to assessing or assisting countries in strengthening the veterinary infrastructures. In other words, they will not operate unless the diagnosis has been done with this harmonized international tool. So the tool recognizes 4 core components that you may recognize that I used at the beginning of this talk. The technical capability, the human and financial capital, the interaction with stakeholders, and the access to market. In the technical capabilities, there are sub-elements: disease diagnosis, early detection, emergency response, quarantine, epidemiological surveillance, risk analysis, and technical innovation, the ability to react to new problems. The human and financial capital talks about the technical competency of the veterinary services, the training and the funding, the stability of policies and programs, having funding for contingencies, the ability to operate independently, and the capability to invest and develop and improve the services continuously. The other 2 elements, the interaction with the stakeholders, as I mentioned earlier, it's important to have a good communication strategy, to have consultation and dialogue with the stakeholders, for them to have an official participation in decision-making, to have a clear understanding as to accreditation and delegation of functions by the veterinary services, to have a credible veterinary statutory body, the one that approves the professionals. In the implementation, the ability to implement programs jointly between public and private sector. As to the access to markets, it talks about the compliance of stakeholders to the regulatory norms, the preparation and updating of regulations, the international harmonization, in other words, the regulations of the country in line with international standards, the ability to have a credible certification system, to have equivalence in other agreements with trading partners during peacetime, to have clear traceability and transparency in reporting and notification, and the ability to implement zoning and compartmentalization when necessary. Thank you very much.